Okay, so I'm going to start palpation videos. You're going to get these in short chunks of video. So this first one, we're going to review surface anatomy of the spine, from the cervical spine to the sacrum. And then I will demonstrate the palpations with Christy in prone first, and then show you what I'm going to do when she is in supine, and then show those palpations for the cervical spine that are required, that are done in supine. So we'll start with basic surface anatomy. So you remember the superior angle of the scapula. If you want to visualize the scapula better, sometimes that handcuff position will do that. But here is the superior angle of the scapula. Here is the inferior angle of the scapula. When I let her shoulder relax, you'll notice that that doesn't change the levels of that superior and inferior angle. So they're in the same place regardless of whether you have your patient in that handcuff position or out of that handcuff position. It just really creates protraction and retraction. So you can go ahead and relax, Christy. So the superior angle is level with T2. The spine of the scapula is level with the spinous process of T4. The inferior angle of the scapula is at T7, spinous process. So that is a way to orient yourself. Remember, the space between the ribs and the iliac crest is where you'll find the lumbar spinous processes and transverse processes. Thoracic will be where the ribs are, and cervical above that. Okay, so your first palpations of the spine and thorax are the cervical vertebrae palpations. With your patient in supine, I'm doing this so you can see the anatomy, or what I do with my hands when I palpate these structures. With my hands, I support the patient's skull. So when she is supine, I will have a hand resting, so I'm supporting her head, and then this hand will kind of feel for that external occipital protuberance and follow that to the void, which is right here. And I'm not putting a lot of pressure. And then the first spinous process I feel is cervical C2 spinous process. So that is the palpation for C2 spinous process, and it is actually the palpation for the external occipital protuberance. So you just have to be able to find that. It's easier to find with your patient in supine so that the patient's neck muscles and shoulder muscles are relaxed. That is your first palpation for the cervical spine. Your next palpation is C7. So with Christy in supine, I will show you what this looks like then too, in that position as well. You're going to find with flat fingers, pads of your fingers together, so you don't do the creepy palpation techniques. You find the most prominent vertebrae, spinous process. You're going to put one finger on that spinous process and one finger on the spinous process below. So Christy, do you have any pain here? A little bit rotated.
I have a lot of rotation.
Okay, so if you look, right, I found these spinous processes. It's not uncommon to find spinous processes that aren't exactly vertical to each other. There's a little bit of rotation in one of these. I'm not going to determine which one. We'll just call this typical for her because she's not in any pain. You'll have one finger on the spinous process you think is C7 and one finger on the spinous process below C7. Then you will move your patient's head into rotation or flexion and feel which one moves. Cervical vertebrae 7, the C7 spinous process, when you rotate, you'll feel that spinous process shift left and right under your finger. When you flex, you should feel the distance between your thoracic 1 and C7 increase, and then return back to resting position when you have her in extension again. So that's how you do those two palpations. That's what I'm doing when you can't see my hands, when she is supine, which is the direction that you actually want to do these palpations in. While she's comfortable, so I can keep her from having to flip over back and forth, we're going to go ahead and do thoracic transverse processes, lumbar transverse processes. So the way to find thoracic spinous processes is to find a spinous process first. That's an easy way to do it. That'll help you when you look at a skeleton. If you feel a spinous process, generally there should be a transverse process lateral to that. Sometimes it's about 1 finger width above or below where you feel that spinous process. So you'll find a spinous process and then go out to the side 2 fingers if you want to do it this way. The other way is to find the angle of the vertebra, the rib, and follow it until you meet that transverse process. Then you need to get up on top of that transverse process to palpate it. So that's what we'll do here. So if I find this transverse process, if I go out about 2 fingers, I can feel, and if you notice, what I did was move all of the skin up and down so that I can feel the elevations of the transverse processes. I did not do this. The reason I didn't do that is because if I'm lifting my fingers to find it, I'm gonna miss that sensory experience of feeling those elevations under my pressure. So no playing piano on the transverse processes. Or you can find those elevations. Oops, sorry, I rolled on your longissimus there. You're gonna find that elevation either on the vertical or they're both vertical. You just either have all your fingers together. Words are tricky today. Y'all just be patient with me. All right, or this way. That's the way to find those elevations. All right, once you find a transverse process, your salient sign is to put pressure through that transverse process and feel the elevation of the tissues on the opposite side. Okay, when you're doing that pressure, try to keep your fingers arched or arced, not straight, and not the tips of your fingers. It's the pads of your fingers, and you can either use your thumb or your fingertips. Keeping your fingers together will help you avoid that hyperextension. So that's a transverse process of the thoracic spine. Lumbar spine, you're gonna find with your pinky, the iliac crest, and you can do this on the same side or the opposite side. And then you're going to find the erector spinae muscle group. And you have to be beside erector spinae and a little bit deep to that muscle group before you start taking up that tissue slack. And by taking up the tissue slack, I mean moving through that loose tissue or looser tissue until you find a stop. And that stop is the transverse process. When you find that stop, you are lateral to the transverse process. You're not on top of the transverse process. So you find that, and then you need to move on top of that transverse process. You're going to palpate the opposite side so that you can feel the tissue when that transverse process rotates, and Christy's moves right away, right up into my fingers. So that is the lumbar transverse process. So that is it for thoracic and lumbar. Christy can roll over to her back now, and I will do the cervical palpations. So let's keep going. After cervical. And this is what these cervical palpations look like. So I am right-handed, so I use my non-dominant hand to support Christy's head, and then my dominant hand to find the structures I'm looking for. So I will start with finding the external occipital protuberance, finding the little void between the EOP, and look for that first bony prominence, and that is C2. That is the spinous process of C2. That's that palpation. The one we haven't talked about or done is transverse processes of the cervical spine. And remember, those transverse processes are almost right aligned with the external auditory meatus. So I want to be aligned with the external auditory meatus. I'm going to move her sternocleidomastoid forward a little bit, and then using flat fingers, pressure on one side only. You don't want to put pressure bilaterally on a neck. It's vulnerable, feels tight and restricting. It'll cause anxiety in your patients and potentially occlude their carotid artery, which make them dizzy, and that's not a way to win friends and influence people. So you're going to take up the slack, and with that flat finger pressure, feel for those little BBs that are the transverse processes. And once you feel one, that's it. I'm not going to make you put pressure through that transverse process. We will know if you are on one.
Mm-hmm.
I don't want you to try to rotate the cervical vertebrae. Be gentle with each other and just try to find that kind of BB transverse process that is there. Those are your bony prominences of the trunk and spine. The next video will be the muscle palpations of the trunk and spine.